Thank you all for taking some time tonight, for being on the national training. You can feel free to use the chat. We are going to have some discussion right at the beginning here. And so if you want to chime in, just raise your hand or use the raise hand option in the reactions. Tonight, we're really going to be talking about setting organizing goals. I know for me, I'm somebody more recently, like in my recovery at least, that is more like goal oriented. And there are components of like whether I end up actually fulfilling that goal or not. And so one of the things I wanted to just open up right off the bat is just a discussion about when you're, so we're gonna be doing some workshop primarily. So there's not a lot of slides tonight. We're going to be doing breakout groups. You're going to work with a random group of people, and you're going to almost like you're going to adopt a team for the night, working with one another. And so we're going to love the randomness of that. But the goal is to work as a team to come up with an organizing strategy, an organizing statement together, as if you're in the same state organizing team. So you might be from California, but you might end up with people in Pennsylvania and Arizona and so forth. But for tonight, you're on the same state organizing team when we break out and do groups. One of the things, since like I know the type of goals that get me to stick to things on a personal level, on a one-on-one individual level. But I'm curious to know from you all, when you're a part of a team of people coming up with a goal together, what are some of the things that you need just as a team member, or what are some of the things that make it easier to create the organizing goal together? So that's the question to start us off. Raise your hand or your digital hand and we'll take you off of mute. I know you all aren't shy, and so just whoever wants to go first, just raise that digital hand. What are some of the things that you need as a team member when you're coming up, when you're putting goals together with a team of people? We're still allowing people in. Let's go with Nathan first, and then Patty. Go ahead, Nathan. You should be able to mute.
Shared values. Identifying shared values, by talking to each other, having listening sessions.
How do you, so what are some of the ways that, so you're on a state organizing team in Virginia.
Yeah.
What are some of the ways that you and your team members have been able to discover some of those shared values?
By hosting listening sessions, by going from those listening sessions and creating petitions, which has gotten more, I guess, buy-in from the grassroots community who are not necessarily at every one of our state organizing meetings, and continuing to work with that and seeing what's driving in people, while also staying true to what my core values are, making sure that I'm aligned with Tom and Chantel and Allison and Robert and all the other people on our team. So yeah.
I love it. Thank you. Let's go to Patty. What are some of the things that you need as a team member, or some of the things that help you to put goals together as a team? Patty, where'd you go?
You didn't unmute me.
There you are. Hi, Patty. Good to see you.
So for me, I need something that is tangible. So, when we're talking about just absolutes, we ought to do this and we should do that and this ought to exist, that I need, what can I do? What are some actionable steps we can take that'll move us in that direction? That helps get me motivated.
That is exactly what you just said is the core of what we're doing tonight. Is that who in here, and be honest, and you can wave in the chat, who in here at some point in your time with Recovery Advocacy Project or some sort of volunteer organization or team has felt like you're kind of like spinning your wheels a little bit? Has anybody had that? Raise your hand. Go ahead. All good. Yep. Every single team at some point has gone through that phase, and so, but teams have also come out of that phase together, right? And I think some of the stuff we're going to go through tonight is going to help that. Annette, why don't you chime in, and then we're going to go right into the slides. Go ahead, Annette. Oh, missed you. There we go.
Okay, I think I'm unmuted now. Yeah, so one of the things that I've seen is that a lot of times people don't know how to contribute. You know, what is my role? What can I do? And I think especially when we have new members, and I'm saying this as someone who's only been involved for a year, it's like, what can I do? What is my role? How do I contribute? And in other volunteer efforts I've been involved in, if we can't define that clearly for people, that's when we have attrition. That's when people feel like they're not contributing. What am I doing here? What is my role? Why am I part of this group? I care about things, but I don't know how I fit in.
Yep.
So I think like defining goals is really important, but I think even before you get to that, there needs to be some connection with people in the group to talk about, you know, what are your skills? What do you like to do? What do you feel comfortable doing? What are you willing to do? And what are you willing to learn to do?
Yep. I love that. I think you're right on there in terms of building that connectivity between individuals on a one-on-one basis, one-on-one outreach, or as a team. And we have a lot of people that come in to RAP and say, you know, I care about the issues. I don't really know how I'm going to help yet, but I'm into this. And, you know, a lot of folks are in that sort of space. And as team members, if we're working to ask people about their strengths and what drives them, and, you know, maybe somebody's really good at social media, somebody's really good at direct outreach, really kind of putting all that together and understanding the strength of your team. And so thank you, Annette, for chiming in. For the sake of time, we're going to go into the slides, but we're going to but keep all of this front and center as we're going into the workshop tonight. Garrett, you want to bring the slides up here? All right, and Tracy, we'll get to you later if we open things back up. You can go to the so we're just going to look at a couple different models. Some of these are like more like individual sort of goal setting, but they can be applied for teams. Then we're doing breakout rooms, and then we're going to come back and you all are going to present as a group from that breakout room. Next slide. And so we already talked about some of these elements here. I think a lot of people might have heard of SMART goals. That's something that we're not going to dive into and practice tonight, but it's something that we should all kind of keep on our radar. I know as individuals, this has really kind of helped me as an individual set goals where you're being specific. It's something that's measurable. It's something that's attainable. It's not like some pie in the sky stuff. It's something that you can get done as a team. It's relevant to what you're working on. You know, in this case, it would be, it would speak to your state platform, and it's time-based, meaning that you're gonna say, I'm doing this by this date. And so those are things that help keep the individual accountable. Next slide, Garrett. And so you want to think about some of those elements, because I think a lot of times it's not always simple. Like what Patty was saying, it's not enough to just say, okay, we want to do this, and not creating a path to do that, right? And so that's really what this workshop is about. That first sort of A to B is that sort of example. That second sort of A to B on the left side there when you don't have like timelines, or you don't have something that's specific, you might eventually end up at B, but you're taking that sort of all over the place route and getting there. And so what we're going to ask people tonight is to think of your organizational goal setting as building a campaign. And I want people to think about that piece on the right as you're in your groups, where you have an idea, you're building, somebody says that, hey, I think we should be able to do this. You're building foundation, you're bringing people into that campaign, whether it's other volunteers through your listening sessions or your events, you're bringing other people into the process of building your state team. And it doesn't have to be here to here, right? In terms of A to B, it can have different peaks, and those peaks are different actions that you're doing together. If your goal is to register 100 voters in recovery by July 6th, right? And the way that we're going to do that is we're going to go door to door to 20, we're going to cover 20 different recovery houses with our team members across the state. That sort of goal and that time frame is going to have different peaks to it, right? It's not just going to be A to B. You're going to have like a campaign kickoff or an announcement. You're going to do some outreach. And I'm just using this as an example where the more sort of specific actions like Nathan was talking about, like when your team knows where it's going and you have different actions to get there, and everybody knows where you're all going together because you came up with that goal together, it is easier to get there. But it's not a straight line, right? It can kind of go up and down, but eventually you can get to that goal in terms of the resolution. And so I want people to think about it in terms of building a campaign tonight. Next slide. So when you think about the difference between just setting a goal and campaigns, or I think about the campaigns that I've been involved in, whether they're political campaigns or grassroots organizing around environment or recovery issues. I've been on some that didn't have a direction, and it's people kind of going all over the place, and you're like, what is happening? And it can get kind of dizzy sometimes, and you have to reset, and that's okay. You come back to that reset and you get clear with what you're doing. And you're going to be able to do that in your groups here. You would, like Nathan said, you enroll others in what you're doing. It requires some outreach, some phone calls, some emails, some messaging on Facebook to bring people into the equation, finding some organizations and people with shared purpose that Nathan was talking about. It can be as equally empowering as it is frustrating. And that's the wave of it. That's the wave of that, up and down sort of piece to things. But even if it's frustrating or if it's empowering, you still know where you're heading together as a group when you're coming up with those team goals together, and that campaign together. And sometimes you just make adjustments. And so that's kind of some of the differences that I see in terms of in terms of things looking at it as a campaign instead of just setting a goal. And so this is what we're going to do tonight. We're going to have this in front of you. You're going to have it in your chat. You're going to have a PDF of it to take into your groups. When you begin with the end in mind and you do that together as a team, and you all know where you're going together, and it's not just kind of, hey, everybody, this is where we're going, follow me, right? It's something that you bring that purpose together. You know where you're all headed. And so we're going to ask people to fill out this sort of model here. And so we are organizing who to pursue what, like what's the change you want to see, by how, like how are you creating that change, to achieve what, by when. And so it has the dates, it has the different action steps, it has the strategy in how you're going to fulfill that goal. I'm going to go through just 2 really quick examples. of organizations that have done this. There's an amazing organization in in Arizona called Promise Arizona. A good community organizing friend of mine named Chris Torres, who I did some work in Providence, Rhode Island with years and years and years ago, went on to be a part of this campaign. And they were very straightforward with what they were doing as an organization, the same way that you can create an organizing strategy for your team in your state. They did it as their organization. And this came out there's some anti-immigration bills that were passing in the legislature that were signed into law, and immigrants and their families were kind of under this microscope and under attack by policy wise, and they did not have the capacity to fight against it when it was happening. And so they started Promise Arizona, and they came up with this organizing sentence. And to me, it's so straightforward. Where they said, we're organizing immigrants and Latinx citizens. That's the who. To do what? To change the politics of the immigration issue in Arizona, make Arizona a pro-immigration state. So that's the who and the why. How are they going to do that? That theory of change by boosting civic participation among Latinx. Go back 1 second, Garrett. Sorry. Among Latinx and newly naturalized citizens. And then the strategic goals to do that is they're going to do it through voter registration drive, and they're going to target registering 400,000 new voters in that population by November of 2010. They went through waves of doing that. They didn't just like say they were going to do it and then go do it. They went through waves where they had to build up their base. They had to build up volunteers. They had to enroll other people in what they were doing. And so by November 2nd, 2010, they did not meet the 400,000 goal. But to this day, Promise Arizona is responsible for registering over 700,000 people in Arizona. And so that only became a reality because of that vision, because of that shared purpose that Nathan was talking about. Next slide, Garrett. And I just wanted to give this example just in terms of, I'm on the South Carolina Recovery Advocacy Project team, and we decided that we wanted to tackle getting rid of stigmatizing language in our state laws. And so our organizing statement really became, we're organizing people in recovery, impacted family members, and allies to recovery to change the language in South Carolina law to be less stigmatizing by working with elected officials to pass SB 2244 within the next 2 legislative sessions. That's as straightforward as we collectively came to do it. And so that's the kind of example that we're looking for people to construct tonight. Go to the next slide, Garrett. And so that statement breaks down the who, the what, the how, the what again, and the when. When we did that together, and that keeps us on track. And because we were able to kind of put that together and come up with the same sort of campaign goal, and we know where we're going, that if we go to the next slide, what we're able to do, remember I talked about the different sort of peaks and the different sort of actions for us to get from A to B, and it's kind of going up and down. What we were able to do is and this is what Patty was referring to, what are the action steps that will get us to our goals and why? Like, what is if we're going to do a town hall, what is the point of doing a town hall? If we're going to do a training, what is the point of doing a training, right? And so it's like, what is the purpose of what we're going to do to get there? And then who's going to carry out those sort of actions by when, right? And so what we were able to do in terms of mapping that out so far, we said we need a broad petition of support. We created that petition of support. We got a couple hundred signatures on it so far. I volunteered to do that piece, but the team helped with the language of it. But I created the action, and then we created a 1-pager that the team worked on that says this is what we're working to do in South Carolina, and we use that to give to legislators that could sponsor the bill we're looking to get sponsored. And we did outreach to organizations. Nicole Chris did an amazing job with that. went to different organizations in South Carolina. It's like, hey, we're thinking about going after this bill. Is it something that you all would sign on for and have your voice heard on? And they're like, yeah. And so we did some outreach there. We have been in contact with our single state agency about their support, and they're like, yeah, we're behind it. Go get a bill number, go do it. So we're doing it. We want to do language trainings. We wanted a Democrat and a Republican sponsor. Cindy on the team reached out to the Republican who is working to get the language drafted, and Mike Todd found the Democrat to jump on. And so this is something that is going to be a reality because we've made those connections and built those relationships, and we kept the end in mind there. And now we're going to add co-sponsors and do letter writing campaigns now that we have a bill number and some op-eds. And so there's a lot that kind of, it wasn't just a 1 month thing. It's like we mapped out January to July and basically into the fall. And it's going to happen. And so that's kind of what we mean by begin with the end in mind. And so next slide here, Garrett. So what we're going to ask people to do, and we're doing all right with time, Garrett, right? Is that right? And Garrett, did you want to chime in for a minute? I don't know if I missed anything, but right before
No,
yeah.
I think you got, I was just gonna, no, you covered everything perfectly, Aaron. I'm gonna just let everybody know that before we go into breakouts, I'm gonna put a document in the chat. Please open it up so at least one person in each breakout room has the document. But if everyone opens it, then everyone will have it. It'll just be this page right here.
Yeah, this is the gist of the document. So what we're going to ask people to do, like in the first minute that you're with your group, it's not, just pick a topic. Like it's just pick one. These four here, recovery support services, harm reduction, housing, and justice reform. Like those were the ones that were in most of the state platform that they made it into the majority of the state platform. So that's what we're hearing from the grassroots communities most often. And so we just put these up there as an example. You might want to work around recovery support services, and the goal might be, you're working with a local community members to advocate for a recovery community center or a recovery community organization, or if you want to do something around harm reduction, establish pilot program for syringe service programs. And so there's a couple examples here, but the point is not to get, don't spend 15 minutes just trying to pick a topic. Like pick the topic right off the bat, less than a minute, and work towards writing your organizing statement around that topic. Does that make sense? So that you're really kind of focusing on this second one here. And then after you all come together to write that organizing statement on your topic, just work to answer these questions. What are some of the action steps that will get us to our goal, like we did in the South Carolina campaign? And who will carry out these actions by when? And so you might be thinking about, hey, my strength is social media. I'll do that, or my strength is training. I can do a training on this issue and bring people together. And it's like figure out how you can put something together as a team, and then we're going to come back and groups are going to report. So you should have the shared file in your chat. We're going to break you out into random groups. Again, less than a minute in terms of picking that topic, and then really focus on that organizing statement and focus on that. And so you're going to assign somebody to be to write down what the organizing statement is, right? And then report back to the group of, who's doing what and what are some of the action steps that you put together. We'll have somebody from your group, either a recorder and a reporter, back into the main room. So you're going to be in groups for 25 minutes. So it's a good amount of time. And then we're going to just have people report, or 20 minutes, I'm sorry. And then we're going to bring people back. So everybody got it? We're good? Make some new friends if you don't know everybody, and work as a team, and we'll see you back here in less than 25 minutes.
We are organizing under the harm reduction category for widespread availability for Narcan. So all first responders, EMTs, firefighters can carry Narcan. And we will be doing Narcan training.
Mhm.
And we will be contacting all the, like your police
and
unions.
Samantha, you're gonna do the action steps, right? Yeah, and so what is the date that's associated with your organizing goal, Celeste? By when?
August.
August. All right. So you got the who, the what, the how, and the when right there. And then
Yes.
Samantha, you wanna share the action steps that we're gonna get us there?
Yeah, so I'm gonna get the Narcan together. Celeste is gonna set up the training. Lisa's gonna talk with Red Cross. Marilyn will organize talking with other organizations, so like the police and EMTs, all of that. And then we'll all end up taking parts in facilitating the training.
The outreach, very nice. So you have an outreach, you got somebody getting the supply of it, you're distributing it together as a team, you're doing the training and coordinating it. That's great. So is that a clear goal? What do people like about that around the harm reduction? What was some clarity, right? It had some timing to it. It had different
Small,
steps.
yeah.
Hey,
It's
I
a
was gonna
small
say,
one.
Patty, as somebody oh, you're in the second group, so I don't know if you're the reporter here, but what are some of the things you noticed about that first group that you're like, yeah, that's
Well, I mean, harm reduction is this giant thing, and they talked about Narcan, so it was easily digestible and achievable.
yeah,
Love it, love it, love it.
yep. There's a way to do it. They mapped it out, and they can go do it by August. I love it. Patty, you're in that second group. Are you the reporter, or who's the reporter there? Who dat? Should be able to take yourself off of
I
mute.
think it's Sylvia.
Sylvia, where are you? Yep, there you are. Hi, Sylvia.
Okay, so so I wrote it all down, what we had discussed. So I'll read it to you. So we are organizing people in recovery, allies and families to pursue recovery systems of care for loved ones, to create and establish updated recovery, change old systems and reform into unified continuum of care. Our theory of change: train and educate people in the field of recovery, change the language, stigma, and employment, give them employment opportunities. Our strategic goal: town halls, letter writing, campaigns, petitions, advocate for community training for updated information. Our date: within the next 2 legislative sessions. And what are some of the action steps that will get us to our goals and why? Patty will watch current bills and create actions. James is going to organize the town hall. Timmy will do training and social media. Michelle will work on outreach to people in recovery and enroll others into the campaign. Reginald came in a little late, so he said he would just help wherever needed. And myself, they delegated me to manage meetings, keep everyone up to date on progress and needs and our needs.
I love that. Yeah, and like even though like James is the person that's like, yeah, I'll take the lead on doing the town hall piece, it's like there's a whole piece to that too, right? There's different things and action steps just to doing that. And so James can do an organizing goal just for the town hall, right? So like that sort of stuff, like thinking about it in that way, where it's just like, it's not just like, okay, you're doing a town hall. It's like, here's the ways that James can figure out how to do some outreach and find some partners and bring some elected officials in, right? So all those sort of different elements. So nice job, team 2, solid. Room 3 is that's Daniel's group. Diana, Jacqueline, who's the reporter? Johnny Fab. This is a good group. Wow, look at all the all-stars in this group. You're all all-stars, but who's the reporter for that group there?
I am the reporter.
All right.
I will read our sentence. We are organizing harm reduction advocates, allies of harm reduction, family members, people who use drugs, people who've been affected by paraphernalia laws, and criminal justice involved folks and healthcare providers to pursue increased awareness of keeping people safe by educating on the principles and benefits of harm reductions, to achieve pilot syringe service programs in counties that do not have them by educating a different county each month. Some of the action steps we want to take are figuring out the political demographic of each of the counties that don't have SSPs right now and understanding what the different audiences are, determining the messaging that we'll have for different audiences because there will be different benefits we want to relay. And then having a series of educational sessions that really focus on the principles and benefits, not really saying the harm reduction word, because sometimes that can just scare people off, and dispelling any sort of myths. We absolutely did not delegate who's going to do what. We all are apparently going to do it. And I think what overall it was like, if we have a RAP member in that county, that person would be involved of handling all of that. But
Yeah, that's awesome. And sometimes there are action steps that are just like, hey, we're just going to do this action step as a team together. Like that's what we did in South Carolina with the language stuff. We like had a Google Doc to figure out some of the language around we wanted to use, and we just did it together. Johnny?
Yeah, I just really wanted to say big ups to one of our group members that really educated me on something, and that was sometimes the words that we use, even though they are not associated with recovery, but the word harm reduction, rather than the principles of harm reduction being educated to those across the aisle. We're talking about politics in this as well. We're talking about those principles. So I'm really just excited about what our group talked about because it really educated me. You know, I used the word harm reduction. 3 years ago, I was on the steps of our Capitol talking about harm reduction, and I was a radical. And now we have individuals out there, such as our Secretary of Health and Department of Drug and Alcohol, talking about harm reduction, but talking about the principles rather than using the language of harm reduction itself. So I'm just like the group, I spoke too much like I always do, but it was just like, it was incredible just to hear that. I needed to hear those words because it gave me something to take back in my local community rather than using the words, but using the principles, which really sat in with me.
I love that. And we can only get to that spot if we're like creating the space to like learn from one another and listen to people's point of views. And some of the things that I was trying to ask at the beginning of the session are like, what are those things that you need in a team to really come together and come to build those campaigns together? And everybody wants to, some people are trying to figure out their place in things or figuring out what, you know, so if you know how to do something, you're like, hey, I can teach somebody this. Who wants to learn how to do this? Or I want to learn how to do this. Does somebody know how to do that? And like create that environment together, you know, learning about different language, or this is how I'm hearing this. Maybe we don't want to say it like this if we're building a campaign together. And so I love that.
By the way, that was Brittany Jackson, just to call her out, call her forward.
Yeah.
Brittany, I needed to hear what Brittany had to say, and that really helped me. So Brittany, just big ups to you.
Where's Brittany? Brittany, thank you so much. Thank you, Johnny. Thank you, Team 3. Room 4, that's Anderson's group there. Anderson, Linda, Carolina, a lot of Kelly people on tonight. That's Jason. Let's go to Jason. Go ahead and unmute, Jason. You should be fine. Where are you?
Okay, right
There you go.
on. So that was awesome, by the way. Cool meeting everybody in the group. I never met any of them guys before, ladies or fella. So here's what we wrote. We are organizing our community at large in order to prevent or pursue the prevention of opioid deaths by distributing fentanyl test strips to users and dealers and family members, change policies that criminalize harm reduction resources, train and educate the public, and exploring further tools that we can also train others in as we learn more in order to achieve a reduction in preventable overdose deaths by January of 2023.
Yeah, that's solid. I know where you're going. Is everybody else? Is that clear for everybody else? Okay, nods. Yeah, that's awesome, Jason. What did you have some action steps and who's on that?
Yes.
Yep.
So I said I would do the record keeping amongst our efforts and our meetings and help with outreach and emails. Carolina is going to do the training and distribution because she's already really in touch with that stuff out in Cali. Anderson said he's really in touch with the policy and whatnot, so he would work on that piece of it and help with emails. Kathy said she would do the social media piece of it. Chelsea said she would do community education and help with emails, and she would set up a letter with Action Network. And then Linda said she would help with community ed.
Yeah, that's solid. Y'all know who's doing what. You're getting there together, lifting each other up. Seems very organized to me because you're organizers.
I'm glad that they are because they helped.
Hey,
Yeah, they helped
yeah,
me.
it seems like you got a lot from this workshop. I appreciate you reporting back, Jason. Room 5, that was Anna Maria's team. Anna Maria, Sheila, Tom. We got a lot of amazing folks on tonight. Who's our reporter tonight?
I got some notes.
All right, Tom, go ahead.
So we are organizing anyone affected by addiction to reduce stigma by starting a community campaign to organize the recovery community organization by May 1, 2023. And this came out of several people from several rural states where there are no RCOs in their entire states.
Yep, it's a real thing. What are some of the action steps and the who's and what's? Did you get to that point?
Yeah, a little bit. It took us a while to get to our statement. Organizing people in recovery through 12-step programs, Celebrate Recovery, Smart Recovery, accessing people in the medication-assisted recovery community, and also organizing parents of loss.
Yeah, I love that. Thank you so much there's so many people that are touched by these issues. So sometimes when we're thinking about the who, it's like, there's a lot of folks. That who, like, who are our people? That's a lot of people. And so we those people making those connections is what makes these goals and campaigns come around. Last group here, that's Ken Musgrove, Lynette, Nathan, you're all in that last group there. Who's reporting back? Did you all have a reporter?
Looked like Kathy was. Kathy, you should be able to unmute yourself.
Kathy, yep. Hey,
Okay, so we are also looking at harm reduction, and we are going to organize our local recovery community to pursue the legalization of fentanyl test strips locally to start. And we're going to do this by hosting community education events, organizing a social media campaign locally, and we hope that by doing this, we will be able to create local policy change by the end of 2023. And in order to do this, we had a ton of great ideas. So we have decided that we are going to all brainstorm our strengths and weaknesses and what we can commit to, and meet again next week to discuss next steps and responses.
That is solid. I love it. You made the commitment to meet again at this time, and it's ongoing. So for everybody here, when you're in your state organizing teams, like if you ever feel like you're stuck, or like we have teams that they know what they're doing for the next 6 months. They know what they're doing for the next 3-4 months, and they have a solid campaign direction. If you use this sort of basic model of like, who are our people, where are we going, what are we trying, and how are we going to do it, and when are we doing it by, it can kind of get you into that mode of like, okay, like, let's map this out. It doesn't have to be super complicated. Like, let's get it on paper. Let's work together to make it happen.